Good evening, everyone. Today we are going to discuss another set of one-liners in relation to pediatrics. First, most common cause of croup. Among these four, which is the most common cause of croup? Is it rhino, RSV, parainfluenza, or adeno? The answer is parainfluenza. So something extra. Most common cause of common cold is your rhinovirus. Most common cause of pharyngitis is your adenovirus. Similarly, most common cause of bronchiolitis is your RSV. So we can get one MCQ. We can remember most common cause of croup is your parainfluenza virus. Next, knuckle, dimple, knuckle sign is seen in which condition? What do you mean by that? What is this question? Knuckle, dimple, knuckle. This is the affected knuckle dimples when a fist is clenched, causing the knuckle dimple sign. We can see when we are fisting, when a fist is clenched, this is the dimple where we are getting. This is the dimple. This is the dimple. So normally clenched fist has all the knuckles. 1, 2, 3, 4. Knuckle. This is normal. But in Down syndrome, what we are getting? We are getting, because of this short third metacarpal bone, we are getting knuckle, dimple, knuckle sign. Similarly, in Turner syndrome, we are getting knuckle, dimple, knuckle sign. Similarly, in pseudohypoparathyroidism type 1A, because of the fourth and fifth metacarpal bones, we are getting knuckle, but dimple sign. Knuckle, dimple sign is your pseudohypoparathyroidism type 1A. Knuckle, dimple, knuckle sign is your Turner syndrome. Similarly, knuckle, dimple, knuckle sign, this is your Down syndrome. So the answer is, here it is written, knuckle, second, dimple, knuckle sign. The answer is Down syndrome. So knuckle, dimple, knuckle sign is your Turner syndrome due to short fourth metacarpal. We know in Turner syndrome we are getting short fourth metacarpal. So there we can get knuckle, dimple, knuckle sign. Similarly, pseudohypoparathyroidism will get knuckle, dimple sign. Interesting question, you can remember. Next, lowest and highest score in expanded new Ballard scoring. We know this scoring we know, but we can get one MCQ. We can get from anywhere. What is the lowest score and what is the highest score? Is it -10 or plus 40, or is it -10 and plus 50, or 0, 40 or 0, 50? Which one is the lowest score and which combination is correct? Next, as you know, this is the expanded new Ballard scoring. There are some scoring that is your posture, square window, arm recoil, popliteal angle, scarf sign, heel to ear. These are neuromuscular maturity. And for physical maturity, we are getting your skin, lanugo, plantar surface, breast nodule, ear and eye, genitalia. These are the various criteria. But the lowest score is your -10. That corresponds to your 20 weeks. Similarly, the highest score is 50. That corresponds to your 44 weeks of gestation. So the answer here is your -10 and plus 50. Next, radiological sign seen in ECD, endocardial cushion defect. Which is the classical radiological sign we are getting in ECD? The answer is goose neck deformity. In goose neck deformity, in normal heart, the aortic valve is wedged between the mitral and tricuspid annuli, but in AV septal defect, the aortic valve is displaced or swung anteriorly. The anterior displacement creates a elongated so-called goose neck. This is the goose neck deformity, what we are getting in a case of AV septal defect. So this is the classical goose neck appearance is seen in your AV septal defect. Next, radiological sign, classical radiological sign seen in PAPBC. It is not TAPBC, it is PAPBC, partial anomalous pulmonary venous connection. Is it figure 8? Is it snowman? Is it scimitar or reverse? As you know, figure 8 and snowman, these are we are seeing in TAPBC. Reverse is 3 sign coarctation. So the classical sign which you are getting in PAPBC is your scimitar sign. What is the scimitar? Anomalous pulmonary vein that drains any or all of the lobes of the right lung. The so-called scimitar vein curves outward. This is that. The scimitar vein curves outward along the right cardiac border, usually from the middle of the lung to the cardiophrenic angle, and usually empties into the inferior vena cava, but also may drain into the portal vein. This is that classical picture, that is your scimitar sign. This is that. This is just like your Turkish sword scimitar sign. Next question. A 2-year-old child diagnosed to be a case of Kawasaki disease, given IVIG at 2 gram per kg with aspirin 80 mg per kg. Still, child is febrile after 48 hours. Which among the following is true? So, which among the following, among these 4 options, which one is true? Repeat dose of IVIG followed by steroid will be needed. True or false? Double dose of IVIG and aspirin will be needed. True or false? Cyclophosphamide is the next line of management. True or false? Risk of coronary artery aneurysm is decreased by IVIG even if fever persists. Is it true or false? Among these 4, which one is correct? The answer is repeat dose of IVIG followed by steroid will be needed. So, Kawasaki disease, the first line treatment is your IVIG at 2 gram per kg plus aspirin 80 mg per kg per day. IVIG resistant Kawasaki disease, going to say if fever persists for more than 36 hours, then we can say this is resistant to your IVIG. The plan of action is repeat dose of IVIG plus short course of steroid. Tumor necrosis factor, TNF alpha inhibitor, infliximab also can be used as the second line of treatment. Then if still fever is persisting, we can think of cyclosporin. So here the answer is repeat dose of IVIG followed by steroid will be needed. Which of the following is true regarding congenital CMV? Congenital CMV is common intrauterine infection second to syphilis. That means syphilis is the most common, second is CMV. Is it true? Blood PCR is best for diagnosis within 2 to 3 weeks of birth. Is it true? Asymptomatic patients with congenital CMV have high risk of sensorineural hearing loss. Is it true? 30 to 40% are symptomatic at birth. Which one of the 4 is true? The answer is asymptomatic patients of CMV have high risk of sensorineural hearing loss. This one is correct. And about other options, your CMV is the most common. It is not the syphilis. Second is it is not the blood PCR. It is the saliva. PCR on saliva is having more sensitive than your urine and blood. Most common sequelae is your sensorineural hearing loss. 60% are asymptomatic, 5% are symptomatic. 90% of cases of congenital CMV are asymptomatic. Drug of choice is IV ganciclovir, that is to be used for 6 weeks. Next, Conn syndrome is associated with all except hypertension, muscle weakness, hypokalemia, edema. Which among these 4 is not associated with Conn syndrome? The answer is edema. As you know, your Conn syndrome is primary hyperaldosteronism, where you can get hypertension, we can get sodium reabsorption. Sodium reabsorption that can lead to hypernatremia, that will lead to your plasma volume, increased plasma volume, but not edema. Your potassium excretion, more potassium excretion, that can lead to your hypokalemia. That is the cause behind your weakness or paralysis, your metabolic alkalosis and polyuria. So which is not present in Conn syndrome is your edema. Primary hyperaldosteronism, 2 types, your primary and secondary. Hyperaldosteronism, 2 types, primary and secondary. Primary is your caused as Conns. Secondary, the causes are renal artery stenosis, congestive heart failure, cirrhosis and nephrotic syndrome. The one thing we can remember, the difference between primary and secondary hyperaldosteronism is your level of renin. In both the cases you will get more aldosterone, but renin level will be low in primary hyperaldosteronism or Conn syndrome, but the renin level will be high when you get hyperaldosteronism because of secondary causes. This is the clue, this is the MCQ we can remember. Next, which of the following muscular dystrophy is associated with Popeye? This is one interesting MCQ. Popeye. If you look at the image, then you can easily say which among these 4 is correct. Is it Becker? It is myotonic? It is Duchenne or facioscapulohumeral muscular dystrophy? This is the classical cartoon Popeye. So the answer is facioscapulohumeral muscular dystrophy is associated with that classical Popeye sign. Next, spontaneous smile is in an infant appears at what age? Is it neonatal period? It is 1 month completed, 2 months completed, or 3 months completed. As you know, if you look, we are thinking it is the answer is your social smile, but this is not the social smile. This is spontaneous smile in an infant when it appears. It is present at birth. So during the neonatal period itself, you can get the spontaneous smile. What we are seeing the social smile with your eye contact, that will appear after 2 to 3 months. So neonatal period, we are getting the spontaneous. Thank you. Please subscribe to this channel, share this video. Thank you very much.